What options do I have 1 year post-surgery and my ears are back to normal? I had otoplasty done in July 2016 and my ears seemed to look really good for a while. Now they have moved 80% back to my normal position. I have contacted and seen my surgeon, and he has not had a case like mine before. A month ago, he tried something else on one ear, but it still doesn't seem to be working. Please help. I just want normal ears.
Thank you for your question. You submitted your question with several photos, and you state that in July 2016 you had otoplasty performed, and unfortunately the prominence of your ears returned to about 80% of your preoperative appearance. And you stated a month prior that the surgeon did something on one ear, but it doesn't appear to be quite right from your view. And so you're looking for some guidance as to what your options are. Well, in the absence of knowing the specific details of the otoplasty procedure, I can give you some idea of how I make assessments for patients who are in a similar situation like yourself who come to my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Otoplasty is a part of my practice, and I do specific things that I have found have a predictability based on some basic principles that one always has to think about when it comes to prominent ears. So just to review for you, or maybe if it wasn't discussed prior, so that it'll help you understand. When you look at prominent ears, you look at essentially several basic anatomic segments. You look at the upper third, the middle third, and the lower third. Now, in the upper third, you're looking at the area called the antihelical fold. And if the antihelical fold is not well defined, well, there is a certain strategy for fixing that area. And then the other part that is significant is the middle third, and that's called the conchal bowl. And very often there is excess cartilage in this area. Now again, without knowing the details of the procedure, I would suspect that that's an area that was a major part of this challenge. But in addition to, just to complete the rest, is the lower third is the earlobe, and that is where the earlobe can be a little bit more prominent. So when you break down the surgical strategy for each of these areas, we'll start with the most straightforward, which is the absence of a antihelical fold. For that, there are sutures that we place that are permanent sutures, and they're referred to as Mustarde sutures. And these are placed in a way after weakening the cartilage to create a fold. What are the things that can potentially go wrong with in that situation? Well, remember that cartilage does have memory, and memory means that it has a tendency to fold back or go back to its original form unless it is either weakened maximally, which is what I would be doing in a Mustarde procedure for the antihelical fold, so that these sutures are placed and create that shape. So that's, and if a suture breaks, or if someone just kind of lays on it in a way, or whatever happens, the suture just doesn't hold, you can replace those sutures, and you can get that fold restored. And that's relatively straightforward. Where I find the biggest or common area of distinction in strategy, surgical treatment strategy, has to do with the middle third. A lot of my colleagues who do otoplasty prefer to do something called a setback. And a setback basically means the placement of sutures to pull inward the conchal bowl. In my opinion, because there is excess cartilage, the really optimal way is to actually remove cartilage. And when you remove cartilage, well, the memory of that cartilage is no longer relevant, because the cartilage, essentially, if the ear is too prominent afterwards, it just means you can probably remove a little bit more cartilage. But generally speaking, removal of a certain amount of cartilage and everything being measured accurately before surgery and then accurately during surgery, you're able to get a pretty stable result that is not likely to recur. Now again, this is my opinion from my perspective as a surgeon doing this. So I think that it is something for you to ask your doctor the specifics of what kind of surgery was actually done. And I would ask about what is the options, given that there seems to be a certain amount of surprise in your doctor's perception as to why you have this recurrence. But I think that anyone who does this type of surgery should have a pretty clear understanding as to why things happen, because the principles are relatively straightforward. So I would just ask you to present to your doctor the question about the details and whether or not any cartilage was removed in the areas that where cartilage can be removed for the purpose of bringing the ear back. And since the photos are not 100% clear enough, especially in the absence of a physical examination, you may want to also ask about what was done to help the antihelical fold. If you are not getting a sense of confidence about your doctor's management, it is always your option to get an additional opinion and see what other doctors feel is the situation in your case, and hopefully you'll be able to find a strategy that'll work best for you. I hope that was helpful. I wish you the best of luck. Thank you for your question.